this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time. Welcome back to Wellness and Dentistry. Today we're going to be talking about the cost of overthinking things in dentistry, and I am guilty of this and have been guilty, but I've gotten a lot better. I'm Dr. Kyle Stanley. I'm a dentist, tech entrepreneur, speaker, and researcher, and I'm joined by your other host, Dr. Martin Mendelson. Martin is a disabled dentist, coach, speaker, and author, and his first book, One Move Makes All the Difference, is available for pre-order, and it's coming out in just a few weeks. So you can pre-order it wherever books are sold. So together, Martin and I, we have helped thousands of dental professionals pursue wellness in dentistry, and we just love helping people, and we love doing this podcast for you guys. It's our way of really giving back and giving you free access to a bunch of talk about mental health. So, Martin, today is the cost of overthinking in dentistry, and I've seen this with many dentists from around the world.
Yeah.
Why do you think we overthink so many damn things?
Well, I think part of it is our training. I mean, we're trained to treatment plan. And so we're trained to identify problems and then therefore figure out solutions in a correct or appropriate or logical order, however you want to describe that. So I think to some extent we're similar to attorneys, because attorneys have very high mental wellness challenges as well. And it's been well documented. It's because of their training. They're looking for fault all the time, and or omission, and they therefore can't escape it when they go home. But I think that's part of it. I also think that perfection within dentistry, there's perfection and then there's perfection, meaning there's an art and science to dentistry. And if a margin is closed within an acceptable tolerance, that's one thing. But how do you define perfection when it comes to aesthetics? Because it's going to be different for everybody, right? And so I think that's part of it, because there's overthinking. I've never thought of it this way before, but to some degree, overthinking might be something that comes about because it's hard to land on a definitive idea around this is good versus not good. When there's so much gray there, then it leaves room for continuing to think through things. So I think that's part of it.
What you made me think of is I was talking to, who was I talking to about this? Christian Coachman.
Mm,
And we were talking about how there still isn't a defined time in dentistry that they say now it's time to cut into this tooth. So
yeah.
the example that I'm giving you is we have an interproximal decay that we see on a radiograph, and hopefully you guys are utilizing my company Pearl and having AI assist you in this. And if you're not, go to our show notes, get my special discount. You'll get my founder's discount. But anyways, you're seeing something on the radiograph. It hasn't hit the DEJ yet.
Mm-hmm.
When do you go into this tooth? When do you stop watching? Or
Yeah.
when do you remineralize? Or when do you cut a class 2 into this?
Yeah.
We still don't have an exact time to do this, or
Yeah.
an exact research-driven standpoint. Now, I know every dentist may say, well, if it's at this point, then I will. If this point, then I will. But that just leaves us open to overthink about this,
Mhm.
right?
Yeah.
And so you will have, and you've probably seen this, you'll have someone post an image on a dental Facebook group, and people are like, you're an idiot. I don't know what you're talking about. This should be this should be that. You
Yep.
should do this, you should do that. You're wrong, I'm wrong, we're wrong. And I think it's because we don't have these standards. It's like what you were saying about the margins.
Yeah.
If you look at a margin on a radiograph and it's closed, then you may say, okay, that's good enough. But if you looked at it with a microscope,
Yeah.
it's never fully closed, right?
Yeah. Yeah.
So at what point is it acceptable?
Yeah. And I'll extrapolate this further because it's not just clinical, it's also team stuff. So we've talked many times on this podcast about the need or importance rather of structure and clarity around job roles, responsibilities, duties, all that kind of stuff. If that's never been defined, then every time you need to decide as a leader what to do, there are no rules because you
It
never
is so
established the
true.
guidelines to begin with.
It's so true. When you say that, I also started thinking about bonuses.
Yeah,
Another topic that
yeah.
we've talked about a few times on the podcast, but a big pain point for team members, for leaders of practices, for associates
Yeah.
is what is the bonus? And it's exactly what you were just talking about
Yeah.
with duties. It's like
Mhm.
everybody should know how
Mhm.
much their bonus is going to be, or if there is a bonus. Maybe there isn't.
Yeah.
But
Yeah.
you should basically know whether we're doing quarterly bonuses, holiday bonuses, Christmas
Yeah.
bonuses, birthday bonuses, you've been here for 5 years bonuses. That should all be spelled out. And you should basically
100%.
say, I will be getting $685 because of either what the practice did, what I did.
Mhm.
And I know that you also add in I guess it shouldn't be that exact because you also like to add in a
Oh, it's
non-tangible part, right?
yeah, subjective behavioral element.
Subjective behavioral
100%.
element.
Yeah.
Yeah.
Yeah. And we've talked about this on other podcasts before, and I always this sounds like I'm a terrible person. I always chuckle around the holiday time because every single time I see somebody go, "What do I do about Christmas bonuses?" It tells me so much about that practice. And it goes way beyond bonus policies because well, I don't want to get started because I'll go on for minutes. But the point is that structure and clarity is really important. So part of this, part of the lack of structure imparts this overthinking because you 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 we want to do the right thing. We want to be good people. We want to treat people properly. And for 99% of us, it's all coming from a good place.
Yeah.
And so then when you add in this grayness, then all of a sudden you get caught in decision paralysis because it's like, oh, should I do this? Should I do that? Like you were talking about earlier about your own perspective about, needing to investigate every single possibility before you make a decision, right?
Yeah, that is my personality to a T.
Hmm.
And whether that's always been me or that was drilled into me in dental school, I can't really recall.
Yeah.
But I do remember in dental school was kind of when I started noticing it. I love researching. For those of you that really know me, I love to publish research. I love to read
Hmm.
research. And I also like to research products that I'm buying. Just
Hmm.
as a consumer, I love seeing where they came from, what their competitors are, how are prices changing, what are the materials like. I love that stuff. I really
Hmm.
can go deep in rabbit holes on everything from cars to clothes to
Hmm.
leather bags to sunglasses, electronics. I mean, everything that I have bought, I love finding out what are the
Hmm.
options, and then I feel like I can make an informed decision. And I think in dental school, we're taught to be that analytical.
Hmm.
But what I realized the negative part of that is that you're not moving in the right direction. And I think
Right.
now, especially with your book coming out, one move makes all the difference is that is exactly it.
Hmm.
In my opinion, it's better to move in the direction and make the wrong decision, get the
Yeah.
data, figure out that it was wrong, and then pivot than sit there and be in this analysis paralysis. Because I've had times where I have done something in my business or in my career where I just like, yeah, I'm gonna do that. I'm just still researching everything. I'm gonna do that.
Yeah.
And it's
Yeah.
8 months later, and I haven't done anything.
Yeah.
In that time, had I made two wrong decisions, I still could have then came back, made the right decision, and been further along than I was than my original
100%.
situation.
100%. And you would have learned lessons from that misstep
So
that would
true.
inform you for the next step.
Exactly right.
And it's interesting because as you share the title of my book, One Move Makes All the Difference. And often when I lecture, I say one move of thought, one move of action. And so, we can't separate thought from action. This idea of dualism, which is from the 1600s, the idea that the mind and body exist as separate entity is complete hogwash. And there's so much research out there that, what you think will guide your brain's function and the ultimate outcomes. And there's so much fun research on that stuff. And by the same token, we need to understand that thoughts drive emotions that create action or inaction that ultimately manifest our result. It's my team framework that I go into in detail in the book. And so we need to understand that assumptive thoughts, judgmental meaning not necessarily a negative thing, but you are coming to a conclusion about a certain situation. Judgmental thoughts, assumptive thoughts have an emotional connection and therefore an emotional toll that can keep you either deer in headlights, stuck, or too afraid to move forward. So it's a real thing. It's a real
And
thing.
what's great in the, I would say, online course space that
Hmm.
I've been in now for about 5 years is that they're very good about teaching new course creators
Hmm.
to just move first.
Yeah.
So what I mean by that is people that are making courses, a lot of coaches and experts are teaching them just make the course.
Yeah.
The video doesn't have to be the highest quality. The audio doesn't have to be perfect. Your slides don't have to be amazing. It doesn't have to be shot in some mansion with a,
Yep.
$30,000 camera. Just make the course.
Hmm.
And as you go on, you can change it and do better. And that was one of the first times that I heard it was, I think back in 2019 when I was starting to make my first online course for Lightside Academy. And I remember struggling with that.
Oh
I
yeah. Oh
remember
yeah.
working and being like, no, I want everything to be perfect and I want the frameworks to be great and it's so much better now than it was. And I
Hmm.
still have people that are in my group that are still coming to me 5 years later and saying that was just the best course ever.
Yeah.
And it's so much
Yeah.
better now than it was.
It's the message and the content that's important. I mean,
Yes.
you and I both did the same thing. I mean, for those watching on YouTube, the backgrounds that Kyle and I are in right now is the backgrounds of our courses. I mean,
Yeah.
we,
Which is
and
our home offices. Yeah.
yeah, basically. And so done is better than perfect, as the phrase
Yeah.
goes, right?
Why do you think
Um,
dentists struggle with that so much, though? Is it because when we're tested in dental school, done is not better than perfect?
yeah, I would say so. I think
Yeah.
we've just gotten gun shy. Um, we're afraid of being wrong, you know?
Mm,
And also, so then that ripples down to a degree because you see both in study clubs and more so online because people are more brave online, the criticism that a colleague will levy against another
mm,
when you have no idea what was going on that day. And
right.
so I remember even in dental school, don't ask why this stuck with me, but we had a whole course on ethics, and it was actually a really well done course at Maryland. And I just remember the whole concept of justifiable criticism. And
Like
that's
that term.
yeah, it's a construct. It's a I don't know what the exact term is, like a bylaw within the ADA
Yeah.
rules of ethics. Like you're only supposed to justifiably criticize a colleague. You're not supposed to just unabashedly say, "Well, I would never do it that way." And you could argue, well, that's beating around the bush. I'm going to give my patient my opinion. Well, but at the same time, your opinion is based on current parameters. And if you weren't present 2 years ago or 6 months ago or whatever, you don't have a right to say anything because you don't know what the variables were. So I think it's just we just go into this. As I also talk about in my book, like jumping to catastrophe. Like
Mm,
we imagine the worst end case, and that's what we focus on versus the equally possible positive outcome. Because if you
yeah.
don't know the answer, they're both valid. And that's a big change that I've had to really bring into my life. And it's way easier said than done. But if you don't know the answer about somebody's motivation or the reality of the situation, the positive outcome or the positive reason is just as valid as the negative until you know differently.
I want new listeners to understand too that Martin and I are not saying do bad dentistry and just get it
No.
done. We both come from a very high level of dentistry knowledge base, and
Hmm.
I think we've seen some of the best dentistry in the
Hmm.
world through our teaching, through
Hmm. Hmm.
our eras, especially, Martin being
Hmm.
involved with Spear and me having been trained by Pascal Magne and Christian Coachman and Sasha Tripanovic. I mean, we know what world-class dentistry is, and I think both of us at some point in our careers, we're doing world-class dentistry. So we're not saying just get it done
Yeah. Yeah.
from a clinical standpoint, but more from, I think, a mental standpoint.
I would agree. And, the other thing for newer listeners that Kyle and I have in common is me in my past and Kyle currently both work for dental labs, either part-time or full-time. And so we've seen the ugly side of really poor impressions or scans or bites, et cetera. I mean, I used to work in a lab in Florida and people would send wax bites in, in July. And I'm thinking to myself, do you not understand how wax works? But anyway,
Yeah.
I digress. But the point is that as difficult and as challenging and as upsetting as those cases were, they were still the single digit minority,
Yeah. Hmm.
And it's unfortunate and it's just a mark of human nature. There's bad cardiologists, just like there's bad dentists. There's bad car dealers and great car dealers. I mean, it doesn't matter. Pick the job. It's
Yeah,
just,
what's funny about dentistry, and I know we're going a little bit on a tangent here, is
yeah.
that I feel like people are more inclined to criticize another doctor or another colleague. And I think it has to do with their identity.
Hmm.
I don't know. I mean,
Yeah.
maybe it's just because I live in dentistry, but I hope that medicine is different, podiatry is
Hmm.
different, you know,
Yeah.
ophthalmology, optometry,
Yeah.
veterinary. I would hope that there's more difference, but I see so much criticism.
Well, and maybe it's also a coping mechanism to make yourself feel better because you are overthinking and you're thinking less of yourself. And so, therefore, if you extrapolate and say, well, at least I'm not doing that, then it mitigates the negativity that you're saying to yourself in those quiet moments. So,
Yeah, and this idea of overthinking. We want you guys to know that this happens in every aspect of dentistry. So,
mhm.
yes, it happens in clinical, happens in treatment planning, but I actually think it happens less in those areas and it happens more in the soft skills part. So, I
Mm,
think because we are so focused on clinical, we're kind of like, yeah, in my practice, that's a crown. Or, yeah,
yeah.
in my practice, that tooth is hopeless and should be extracted. Or, yes, that needs an onlay or this is a veneer, whatever. We do that all the time, so I feel like we don't overthink clinically as much, but
Mhm.
we do overthink in, like Martin always says, now I have to hire somebody.
Yeah.
What do I do? Like,
Yeah.
where do I go? Where do I start? Oh my gosh, it's so overwhelming. I'm never going to do anything.
Yeah.
Or I want to start marketing because I need new patients in my practice. Gosh, what do I do? Do I get a marketing agency? Do I talk to my friend? My friend's daughter said she's in marketing. Is maybe I can talk to her? Do I do ads? Like what? I don't even know.
Yeah.
I don't know. Do you agree with me? Do you think that we overthink more in areas where we're not as familiar?
I think so. And I also think that uh, we can then be susceptible to the assumptive part of things that the last time it didn't work out with this person that we hired, therefore we have to be more cautious this time. And in my coaching program, there was a foundational principle around assumption. And it is as it sounds, meaning, you can't assume that the same thing's going to happen the exact same way unless all the variables are the same. And so when you extrapolate that to a hiring challenge, well, nobody wants to work anymore. And I've said it on this podcast multiple times. If you flip the script and you imagine yourself saying to a potential applicant that's sitting in your waiting room, oh, you're probably not going to work out because nobody wants to work these days. And the last three people didn't work out either. Like they would walk out on you because they realize you don't have any faith in them. And if you think about it, it's not even an exaggeration. That's what we're thinking. We just don't express it.
Mm.
And if you flip the script and actually said it out loud, all of a sudden it becomes nothing short of bizarre in a lot of ways. So the assumptive thing I think gets us into trouble with the overthinking thing because there's nothing taking, I certainly don't want to take away from people's negative experiences in hiring and partnerships and all this kind of stuff. And any one of those experiences that are terrible are what they are. They're terrible. And that also doesn't mean that future experiences have to be that way too.
So overthinking is related. What did you just say? There was a word you said that it was related.
Assumption.
Assumption.
Yeah.
Hmm. Okay. So if we're going, I mean, I think this is great, and I'm thinking about it as it's happening, is overthinking is related to assumption.
Hmm.
How can you not have assumption? And
Hmm.
that is structure and clarity.
Yeah.
That is good communication.
Hmm.
That is expectations,
Yes.
boundaries.
Hmm.
And
Yeah.
so much of that are
Hmm.
things that dentists are not focusing on.
100%.
Very few dentists are focusing on how do I get better at structure and clarity? How do I get better at setting expectations,
Yeah.
boundaries, communication?
Yeah.
And that is a lot of what we talk about on this podcast is how you can reduce your stress by focusing on non-clinical things.
Hmm. Hmm.
And most people don't put any effort into this because they don't see the value.
Yeah.
And so I think that if you've been listening to this episode and how we've been talking about overthinking and how we were trained and really what we go through every day, you should be able to see that connection that Martin made, which was
Yeah.
overthinking has to do with assumption.
Hmm.
And
And
I'll tell you this, a lot of stress in my life has to
yeah.
do with assumption, not even in dentistry. I'm talking about
Oh, yeah.
with my kids, with my spouse, with my neighbors, with my,
Hmm.
business partners.
Hmm.
Whenever there's an assumption, you get resentment. And what's funny is when you have these conversations where you're trying to clarify things and you're communicating well, everyone's kind of like, oh, that's what you meant?
Exactly. Yeah,
Okay. Okay, cool. Yeah,
exactly.
we're good.
Exactly. Yeah. I mean, I mentioned this in a couple of recent podcasts, but I hired somebody on my team as an assistant, and I'm really practicing what I preach relative to structure and clarity. And so, for example, the day before we're recording this episode, I had another dentist client engage me for coaching services. And so I want to now turn over this process to my assistant. Well, there's a lot of moving parts
The
because there's,
onboarding you're talking about?
yeah. So there's, creating the contract from data. There's, creating the invoices. There's setting up, depending on which assessment we're going to use. There's setting up the first couple Zoom meetings. There's a lot of things to do. And so did it take more time to sit down and type everything out and think about it? And yes, it did. But it took me because I watched the clock. I actually figured this out. It I know that shocks you. It it took me about one and a quarter times longer to delineate everything out than it does per one new client.
Wow. So you do it one time,
Correct.
a quarter longer,
Correct.
and can then completely delegate this.
Well, and I practice what I preach relative to delegation. So we had a meeting this morning. We were on Zoom. We went through the folders. We went through the templates. We went through the guidance documents. And there were a couple of times when I realized, oh, that's not clear.
Hmm.
And so it was actually a couple of files that we had to like name differently or
Yeah.
name more detailed. Um, and then I do what I always do. I'm like, okay, great, play it back. I was like, oh no, this is really what I meant. Oh, great. Thank you for sharing that with me. I didn't realize I didn't communicate properly. So now everything is delineated, and it is not an easy process. However, what is the cost of not doing it? That's my question, you know,
Well,
because
I think we do this a lot in dentistry in that we assume that patients understand things
yeah,
when it's so normal to us and it's so absolutely simple and every day we do
yeah,
it 100 times.
yeah,
For the patient, this is the first time they've ever heard of this.
yeah,
So I know people do this with dental jargon.
hmm,
They say things like, oh, on tooth number 8, we're going
yeah,
to do this. And the patient's going, what are you talking about?
yeah,
Or they say, we're going to do a Emax crown, Emax onlay,
yeah,
MOD on this tooth. And the patient's going, what do you mean?
exactly.
Or they're looking at even a consent form that seems so normal to us. And, we say things like send them to a specialist. And they're like, wait, what is a specialist? What does that mean?
Yeah,
And it's like we have to sometimes think in the other person's shoes, understand where they're coming from, which is hard sometimes,
yeah,
especially because we're so deep into this,
hmm,
to remember things like that. I mean, I get
hmm,
messages from a lot of my non-dental friends that will ask me, to us dental people, the stupidest questions. I
yeah,
mean,
yeah,
I say that kind of tongue in cheek because they're not stupid. They don't get it. But
yeah,
they'll ask me the dumbest questions,
yeah,
not the dumbest, the simplest questions,
sure,
let's
sure.
say. And they're honestly curious about, well,
Hmm,
what does this mean? And why would you do that? And, like, why do you brush in the morning? Like, I haven't eaten food yet. Well, what was
yeah,
the
yeah, yeah.
reason? And it's funny what you're saying is the same thing that sometimes, and I'll see this with my own writing, like when I'm writing emails or when I'm writing contracts or even creative stuff, like for my email list, I usually send out a weekly or bi-weekly email of what's going on in my life or some story. And as I'm writing it, I'll read it and then I'll go back and be like, wait, they don't have that context. They don't
Mm,
they
yeah,
don't get that.
yeah,
And that was so simple and understandable for me,
yeah,
but from the other person that's not. And this is how these assumptions happen.
hmm,
And these assumptions where people make an assumption about you that could be right or could be wrong. Many times I think it's wrong. And that's where we get so many of these problems.
hmm. So I think for me, because I figure you're going to ask this, like, what's one of the solutions?
Yeah.
One of the biggest solutions is really retraining yourself to look at the world in a curious place versus an assumptive or judgmental place. Because think of it this way. Let's say your assistant comes in and responds to a statement that you made and it seems rude. How about that?
Hmm.
Right?
Okay.
You could simply say, I wonder what he or she meant by that, and ask the question.
Hmm.
Versus, oh my God, I can't believe he or she said that. Why would they say that? What did they mean? What does this mean? Are they looking to leave? Blah, 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 blah. Like, do you see how this can like just cascade out of just ad infinitum? So the curiosity piece ends up being a tool not only to answer the assumptions or to nullify them, but it also can stop the cascade of thought because you can't really go any farther until you get the answer.
This is such a powerful skill. And I will
Mhm.
say that this is a skill.
Oh yeah.
And if you can create this skill and constantly be reminded of it, so we talk about it a lot on the podcast. I
Mhm.
hope you guys that are listeners every week,
Yeah.
it's now been burned into your brain of coming at the world with curiosity. But the people that can come at the world with curiosity, they they can be almost these monk type
Mm.
people that are stoic, and I don't
Hmm.
mean no emotion, but I
Yeah,
mean
yeah.
no super highs and super
Hmm.
lows. They kind
Hmm.
of are at this even keel a lot, even when bad things are happening.
Yeah. Well,
something great is happening. They're like, oh, wow, I wonder why that happened. That's cool that that happened. Something bad happens. They go, oh, that's interesting. I wonder why that happened.
yeah. Well, I posted on LinkedIn and I think some other socials over the weekend. We went out for breakfast and this patron left and he opened the door. I think it was a he. And the door stayed open. And it's still hot here in Arizona. And I was just like, huh, I bet he didn't realize he left it open. So I got up and I closed it. But it
Yeah.
just made me think, and I'm like, I wonder how many people would have been like, that idiot, blah, 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 blah.
Yeah, he's just thinking about himself.
Right,
Doesn't he know
right,
that the restaurant has to
right.
pay the AC and it's 100
Yeah,
degrees
yeah.
outside and we're all
Now
sweating in here?
the interesting thing is that I got a lot of engagement on the post. Most people are like, "No, I wouldn't have assumed. I would have just gone up and closed the door." And I'm thinking to myself, yeah, most people would not. You know,
No,
yeah.
this is a skill. And I know people like this.
Oh, I do too.
And from a positive standpoint, I know people that
Oh,
I'm
yeah.
saying from a
Oh, I know
positive
them too.
standpoint, I know few people from a positive standpoint that are like this. And they're just the chillest people.
Yeah.
They're so fun to be around.
Mhm.
It's really the kind of people that I want to spend more time with.
You know what's a great place to hang out to train yourself in this skill?
Hmm,
An
the
airport.
airport.
Because you overhear the most interesting conversations, even amongst people traveling together. And so often I observe something and I'm thinking, what is the big deal? Like what that never would have occurred to me. Like, why are you so it's just it's very interesting to me, this
Well,
whole
people
subject.
love to complain. There's something about like um, misery loves company. You know what I
Hmm.
mean?
Hmm.
And I think
Hmm.
that can be a positive thing too when you're talking about feeling understood, not being out on an island by yourself, especially,
Hmm.
like when it's Suicide Awareness
Hmm. Hmm.
Month and we're talking about people feeling challenges and you want to feel understood. And misery does love company in that
Yeah.
kind. But I think people also just love to complain. It's like
Yeah.
it gives them something to talk about.
Hmm. Yeah. I would
You know?
agree. The for whatever reason in our society, it just feels easier to complain than to compliment.
Hmm.
And so I try to go out of my way to look for things to compliment versus look for things to complain. It's just
Yeah.
I find that I realize now rather that I spent a lot of my younger years more in the complaining side or the negative side. And I like this version of me a lot better. I feel much more, chill. And even when something untoward happens, let's say with travel, it just makes things easier. I remember this was about a year and a half ago. I got pretty significantly delayed on the way to a speaking engagement, but because of where it was and a bunch of other factors, I had plenty of time, which doesn't always happen.
Yeah.
And so, although I ended up getting stuck for like 4.5 hours, I thought to myself, well, but I got all this stuff to do. So why don't I just do it? And then I felt so good for having accomplished that. So I chose to focus on the opportunity rather than complaining that I was delayed for 4.5 hours. But again, that's a skill, right? The old me would have been
Totally a
like, what?
skill.
So yeah,
Totally a skill.
yeah.
The people that I was just thinking of that are really even keel are in my life now are a lot of the guys that I train jujitsu with.
Mm,
Um, they, and I don't know if this happens because they're much more able to control their emotions. Because when you're fighting somebody, many times we're going 100%,
yeah,
but there's no ill will towards the other person.
right, right.
It's like someone kicks your ass and you go, wow, great job. That was awesome. Oh my gosh, amazing. I learned so much. And I see this all the time now. And
Mm,
I'm wondering because it doesn't come back to what we're talking about with structure and clarity at all. It's not that they're amazing communicators,
hmm.
but I think it's more just about being in touch with their bodies and their emotions
Yeah.
and knowing how to do that. Like one of my professors, I did jujitsu yesterday, and one of my professors always reminds us to control your breathing
Hmm.
as you're doing it. Even when, someone's kicking your butt, you don't want to go
Hmm.
like, right? It's like you're controlling your breathing. That makes you control your
Hmm.
thoughts more, and that makes you think rationally about
Yeah.
getting out of something,
Yeah. It's
right?
a
Like,
tool to
oh,
combat overthinking, is what you're
yeah, and
talking
maybe it
about.
is that curiosity. Maybe it is that, okay, my arm is pinned and I can't move that one. Huh. How can I get out of this?
Exactly. Yeah. Easier
Instead
said
of,
than
well,
done.
I'm screwed. He got my
Yeah.
arm. I'm
Yeah.
done.
Yeah. Yeah.
This has been a great topic.
Yeah. It's it's an interesting one and it's universal and it's everywhere. So,
Yeah. Well, if you guys liked this and you think you've got colleagues or team members that need to hear this, please send it to them. That's all we ask of you guys. And next week, I think, are we getting close to Thanksgiving? Oh my gosh, yeah.
yeah,
Next week, I think will
next
be
week
our,
is Thanksgiving.
yeah, wow. Time is flying by. So we're going to do something special for Thanksgiving. I don't know what it's going to be, but we'll do something special. And we appreciate you guys staying with us on Wellness and Dentistry. Martin and I love doing this. We love hearing your comments, your thoughts, which episodes you like. I didn't tell you, Martin. I just got a DM the other day that someone really liked the episode that just came out last week, and they messaged me and were like, "This was an amazing one." So,
I
yeah.
love it.
Well, anyways, guys, we'll see you on the next episode of Wellness and Dentistry.
Bye-bye.